Dr. Murphy presents questions and answers about facial cosmetic surgery.
Hi, I'm Dr. Terry Murphy. I am a board-certified plastic surgeon. I'm Chief of Plastic Surgery at Swedish Medical Center, and I want to talk about facial cosmetic surgery. Facial cosmetic surgery is a wonderful, diverse field in plastic surgery. Each patient who comes in who is thinking about having facial cosmetic surgery has certain things they have seen which have changed over time they want to address. My job as a plastic surgeon is to approach each area of the face based upon what has led to the issues that they're seeing, what has caused the facial aging, and then develop a plan of treatment to reverse those findings.
What is your approach to facial plastic surgery?
I approach the field of facial plastic surgery from the point of view that there are 3 or 4 things which have potentially contributed to the appearance of facial aging. It's important to evaluate the quality of the patient's skin and think in the past, has there been insults such as smoking, sun exposure, things which have caused the skin to look older with fine lines and wrinkles? Are there pigmentary changes? Is there loss of elasticity? These are all important things to think about. I think that the loss of volume is an issue which is perhaps not adequately assessed by a number of physicians as they're operating on patients for facial rejuvenation. It's been well shown that over time, the fat in the face shrinks up some, the subcutaneous tissues will shrink up, collagen will go away. It's important in many patients who are having facial cosmetic surgery that the subcutaneous volume is reestablished during the procedure. The third part of the assessment of patients who are requesting facial plastic surgery looks at what gravity may have done. Is there laxity of tissues? Have some of the more important tissues, perhaps like the malar fat pad, which lives through here, has that come down over time? Is there jowl formation, loose skin in the neck? This is added to effects of the skin, loss of volume, to give a full assessment of the facial plastic surgery patient to come up with the appropriate plan.
After we assess my needs, what happens next?
Once the assessment is completed, we move on to the planned surgery. The consultation involves discussion of which procedures may be done, including elevation of tissues which have become lax. I typically perform as either a cheek lift or a neck lift, or a combination of the two would be a facelift. As I'm performing this procedure, I'm operating on the deep layers which have become lax, more in a vertical component, and they're elevated into position, and the overlying skin is redraped and tightened over the deep structures. In combination to that, we commonly add volume to the areas which have lost volume over time, such as around the perioral area. There can be loss of volume in the lips, loss of volumes in some of the folds in these areas, and frequently a hollow area underneath the eyes. The quality of the skin is then addressed. Typically, I use the erbium laser, which resurfaces skin. It will smooth fine lines around the mouth, around the eye. It can decrease pigmentary issues, skin irregularities, safely and effectively.
What about upper facial features?
Commonly, while discussing options to improve the lower facial appearance, the cheek and the jowl and the neck, we'll have a look at the patient's upper facial features. We look at the quality and location of the brow tissue. Frequently, the brow can come down some, cause some hooding, so it's not uncommon we perform brow lifts. Also, rejuvenation of the eyelid is important. Sometimes people have excess skin and fat of the upper eyelids. Wrinkles both medially and laterally have to be improved by releasing potentially muscles in this area, and also improvement in the quality of the lower eyelid.
Tell us about the lower eyelid and facial rejuvenation.
Evaluation of the structures of the lower eyelid is a very important and sometimes difficult part of establishing facial rejuvenation. There are many structures involved. There can be prominence of fat in the lower eyelid, there can be lack of fat, there can be laxity of skin, and laxity of the supporting structures of the lower eyelid. Careful assessment of these structures of the lower lid will lead to the ultimate plan. Sometimes we remove excess fat, sometimes we even add fat to the area. And then frequently we'll do a procedure to either smooth the skin or tighten it to give the most youthful appearance.
What is your overall approach to facial rejuvenation?
I think you could consider my approach to facial rejuvenation in sort of a holistic or all-encompassing context. As I mentioned, it's important to think of the 3 factors which have led to facial aging. Make sure you're addressing those with each patient appropriately to give them their best final result.